Hi, welcome to Western Medicine, the Humanity Behind the Vanity. You're listening to Talk 1260 KTRC. This is Dr. Dana Ronel. I'm a plastic surgeon here with my wife, Betsy Ronel. We got a great show today.
What are you going to talk about?
Today, I want to talk about the body lift.
Oh, that's a big one.
It's a big
6
surgery.
hours.
Yeah.
He always lets me know when he's about to do one of these because he texts me, I'm about to go in for 6 hours body lift. That's code for don't bother me, no matter what. Okay.
The reason that the surgery takes so long is
So your patients know you're getting his ultimate attention. Okay. Sorry.
What a body lift is pretty much it's a combination of abdominoplasty, a tummy tuck, and a buttock lift, butt lift, and an outer thigh lift. It's also known as a belt lipectomy. Lipectomy means to cut out fat, and it's basically making a big circle around the waist and lifting and cutting things out.
Is it a big juicy scar?
It's just like a tummy tuck scar or a butt lift scar.
Is it a one continuous scar?
Yeah, it's one continuous scar, and its thickness and its color depends on the individual person, but usually it heals with a nice thin scar after a long time.
So what goes on here?
But
Explain it.
what it is you got to be healthy. The patient has to be healthy. It helps if the patient is not overweight or not too much overweight. And they have to be prepared for a long recovery period. It's not going to be...
You're kind of incapacitated.
Well, they're not going to be dancing the hoochie coochie for 10 days, 2 weeks at least. And so they need a good support system.
Right.
I like doing these in the hospital, or at least in a very, well-equipped private office or surgery center. Just because it's a long surgery.
It's a long surgery.
Yeah, and sometimes patients take a long time to wake up. It's not going to take an hour in recovery. It may take a couple hours. So, but most patients go home. Almost everybody goes home the same day. Yeah, after you start in the morning, you finish at 1 in the afternoon. They go home at 3.
How much pain are they in?
It's really not that bad. I like using the Pain Buster.
I mean, you've had, the iFlow.
Yeah, they're one of our sponsors, by the way, very generous sponsor, iFlow, and they make the OnQ Pain Buster, which is a balloon full of anesthetic, and you wear it on a fanny pack, and it contracts and it shoots in through tiny little tubes, pain medicine right into the site of surgery, and studies have shown that people use fewer narcotics when they're on this.
Right, but so you've got a tummy tuck, which we all know is not easy.
Right.
And then you've got the butt lift.
Right.
So you can't move in any direction.
It's uncomfortable. You really can't. You shouldn't sit for about 10 days or 2 weeks. You can lie flat on your stomach or on your back and you can stand, but after the buttock lift you shouldn't sit.
Aren't you supposed to try to sit with a tummy tuck?
No.
Oh.
No. You don't have to. You need to walk. No, you need to walk. Just to keep the blood circulating. But like I said, it's a big deal. It's not a surgery to be taken lightly. A lot of people like to do it because by combining surgeries, you only have one downtime. You save some money by combining one time. Right.
Oh, I admire anybody who goes through that. Wow.
Yeah.
That's awesome. That's a feat.
And the pain is really not that bad. This is not muscle, it's not like we're cutting muscles.
Well, you are on a tummy tuck.
No, you don't cut a muscle on a tummy tuck. You just move it together.
You pull it down.
You push it, pull it together, but you don't cut it.
I thought you cut into it.
No, like
Why
in a C-section.
Why is everyone so, uncomfortable?
It hurts. It's surgery.
All this time, I thought a tummy tuck, you cut the muscle out.
Wait till you have one. You'll see. It's not a big deal. Most people
I have seen some people who have had them, and it's a big deal.
Okay, well, some people have.
I have seen them right after surgery, and it's a big deal.
Okay.
For some people, want me to do one on you, and then you can tell me it's not a big deal.
No, thank you. No, thank you.
Want to have a baby too while you're at it? Not a big deal. Okay, men, thank you so much.
Well, in any case, you don't cut the muscle on the tummy tuck. You just move it together.
Well, all this time, you could have corrected me. Months, years, I've been thinking you cut the muscle, and you know it because I've had this conversation with you.
Okay, but I can't read your thoughts, so I don't know.
Yes, I can.
But anyway, so that's the body lift. What else can I tell you? Some people,
very vocal.
All right.
Okay.
Listen, people who have massive weight loss are great candidates for this.
Absolutely.
They actually need to have more than that. They want their arms done,
they need everything. They need their legs, their thighs.
You have to do it in stages.
Of course.
But the body lift is the tummy, the buttock, the outer thigh. It all goes together. pretty customary to do revisions also. This is a big surgery, and sometimes the incision doesn't heal quite so well, or you might have a little asymmetry. Most revisions can be done in the office.
Yeah.
You know, a little nip and tuck here. Sometimes when people come back for another surgery, like the inner thigh or their arms, then you can do a revision of the original, you know, belt lipectomy or body lift.
You do lipo with all this?
You can. I'm not a big fan of combining lipo because I would rather just make an incision and cut the fat out and sculpt it right there, what I can see.
Really?
Lipo is something that you do at a distance, and after a surgery, I like to keep whatever's left over pristine because the blood flow has to go through that area and it needs to feed the healing of the incision. So if you do a tummy tuck, for example, and you also do lipo of the hips, you can reduce the blood flow to the tummy tuck incision. It's got to heal. So I'm not a big fan of. Sometimes I do, but I'm not a big fan of it.
I mean, are there cases where, I mean, what if the body is dictating, oh, I need lipo, it needs lipo?
Well, then you
do it later, or
you
do
can
it
do it in
then
stages,
too?
right?
Right,
No,
okay.
no. Whenever the body dictates something that's too much
Yeah.
for one sitting, you do it in stages, and that's the safest way to
And
do
that's just
it.
for their safety and health, right?
Yes.
That's smart.
Yes, absolutely.
You're in good hands with Dr. Ronel.
Okay, you learn from experience. You learn from the meetings where everybody talks about their complications.
Yeah, this
The
man
breast.
is always reading or something. We never get any of his time. He's always reading something. So all the patients out there, you really benefit.
The Breast and Body Contouring Symposium, which is in Santa Fe every year. It's an international meeting. It's a great meeting, and this is where we talk about all these things.
Yeah.
So, I think if you've got a healthy patient, you use the pain buster, you give them some pain medicine afterwards, they have a good support system, I think they'll do fine. You just have to select the patient correctly. It's really important.
And the patient has to be very educated.
Yeah, and they have to be willing to work. They need to get up and walk around, and not just sit around. They got to walk to keep the blood flowing so they don't get blood clots.
Absolutely.
They need to have a good support system that will push them to walk. And that's it. That's it. So anyway,
we just go over your sponsors because you forgot them.
Okay. We
We're
wanted to
sponsored
say
by iFlow, which we mentioned, the manufacturers of the On-Q Pain Buster, and
Geneva Medical, the makers of Artifil.
love it.
Grateful. I want to thank you for your support. And
that's it.
That's it for now. We'll be right back. Thank you so much for listening to Talk 1260 KTRC.